let us know so we can unmute your mic. And we'll go ahead and get started. And also, just as a disclaimer, this is some of our first call-in webinar, so certainly mine. This is the first time we've done a webinar where it's a collaborative effort and where we're encouraging folks to call in or to talk with each other. So we apologize for any communication snafus that might happen. But hopefully this will be more of an interactive session than even the last webinar was. So I think we'll go ahead and get started. And I also want to say that Julie Stagg is here with us, and our two Texas Mother Friendly folks, Kelsey Hagan and Riley Stoltenberg, are on our end. And then we're also going to be hearing from other presenters throughout the forum as well. So I'll just briefly go over what we'll be talking through today. We'll be hearing from several folks on resources that they have. So we'll be hearing from folks who have developed resources for breastfeeding in the workplace or for their recognition initiatives. And then we'll be talking about some cross-collaboration success stories. So there are a few states who have collaborated well with each other and might have some best practices to share with their collaboration. And then we'll discuss best approaches to further collaboration. So kind of the vision of this project was to have multiple states collaborating, or have at least the platform to collaborate. So we'll kind of discuss how that could happen and what some of the best practices and approaches are to building that collaboration. And then we'll discuss how we can move forward in that. So I want to briefly go over the presenters. We have Linda Kopecki from Colorado, who will be discussing some of their resources. And then Julie Stagg from Texas, who will be discussing the Texas Mother Friendly Worksite resources. And then Martha Hagan from Kansas is going to be presenting some of their resources and also discussing some of their collaboration efforts with Missouri. Brenda Bandy could not make it on the call, but she was instrumental in building some of the content for this. And then for Maryland and DC, Dana Silver and Sahira Long were instrumental in providing us some content, but they were not able to make the webinar. So Kelsey Hagan will be presenting their information. So I think we'll jump right into resource sharing, and we are going to discuss the Colorado Workplace Lactation Support, and I will unmute you. Yeah. So Linda, if you'll unmute, and hopefully we'll be able to hear you.
Hi, this is Linda Kopecki. I'm with Boulder County Public Health. So we're a county in Colorado, and we're just north of the Denver metro area, and include Boulder and Longmont and some other smaller towns. And our work in Colorado on breastfeeding-friendly work sites is county by county. So we don't have a full statewide effort, but it's county by county. And the work that we are doing is funded through Colorado's tobacco tax. 4 areas in Colorado have funding to do breastfeeding-friendly worksite efforts around their counties. 2 of them are single counties, and the other 2 are rural groupings of 6 counties each. So Boulder County, we have developed many of the resources that the other counties are using, and as this grows to other counties, they'll be using these resources as well. So the one that you see here, this is actually developed by University of Northern Colorado in Greeley, and it's the breastfeeding-friendly toolkit for colleges and universities. And so this is something that can be used at any college and university or any community college, and we're currently using this with University of Colorado. They have 3 campuses that are in 3 towns and 3 different counties, and we're working with them. UNC is breastfeeding friendly. We're also using it with our local community college. So you have other, okay. And this is, so with our breastfeeding friendly worksite, we work with worksites to be breastfeeding friendly, to provide time and space for the employees, as everybody does, and to have a written policy. We also know that the other side of that coin is when businesses are public facing and interacting with the clients or customers or the general public that come in. And so this is an employee poster that we have to support the breastfeeding friendly public space. It's an educational poster, and it's just something they can put in their break room. We require 3 things when they commit to being a breastfeeding friendly public space: that they have signage like the international symbols, the window clings. They have information for employees and volunteers, which is this poster. We have this in English and Spanish. This bottom section is just dialogue or recommended ways to communicate with the public. In case they have that 15-year-old employee that has never seen anybody breastfeed in their entire life, and they have a customer complaining about another customer, that employee feels supported and they know what to say. And they know to not ask that person to leave or not to cover up. So it's just good recommendations. You can go to the next piece as well. This is the toolkit that we developed for the employers, and it's fashioned after the toolkits that were developed by the New York State WIC office, but it's specific to Boulder County. Those are our mountains. And it has all of the information that an employer will need. So we interact with employers, or we find employers who want to be breastfeeding friendly in a variety of ways. They read about our work in the newspaper. We send emails. We connect with them via our environmental health division that works with businesses in other ways. But we also go door to door. And so we take a lot of these toolkits with us door to door. And we talk to the manager or the supervisor or whoever is there about what their needs are. Do they have employees that are coming back from maternity leave? How do they support them? And we can be a resource to them. So this toolkit really has all the little bits and pieces. You know, what are the laws that they need to follow? Why would they want to? What are the incentives to being a breastfeeding friendly worksite? We also have some funding to reimburse businesses for setting up lactation spaces, basic needs of an employees. And so it's just an outline of what it means to be breastfeeding friendly. And we also have an assessment, which is coming up after this. It's, I think it's the next. So these are all about needs of employee, because a lot of employers have no idea what the needs for their employees are. So I think scroll down to the next page of this. One more. There we go. So this is the self-assessment that we put together. This is also a standalone document. We have it as a fillable PDF, so we can send it electronically to employers. They can click on the little boxes and they can send it back electronically to us. We have it English and Spanish. And you'll see it's not a yes, no. I am or I'm not. I have this or I don't have this. We created something that we wanted to be progressive, so that every business feels like they can mark somewhere on this document and they're on the map, they're on the path to being breastfeeding friendly. And then the green column is above and beyond. It's really what you can do above the threshold for what it means to be breastfeeding friendly. So I know I need to conclude, but so we've worked with, and then this is the campus, college and campuses toolkit too, and that's available for anybody to use. So we, in Boulder County, we have worked with over 150 employees in the 2 years that we've been doing this, and we have about 27 that have gone all the way and been certified as breastfeeding friendly. We're working with other counties around Colorado, along the Front Range, in the mountains, in the rural areas, and we're offering our toolkit to other places. They can change out the photos and change out the personal information, and they can use that toolkit. So we're creating the resources that other places in Colorado can use. That's it. Thanks.
Great. Thank you so much. And now I'm going to turn it over to Julie Stagg to talk about the Texas Mother Friendly Worksite program, and she'll be scrolling through the website. So I'm going to pull that up for her.
So we, the Texas Mother Friendly Worksite program, if you were on the previous webinar in this series, I'd mentioned that this program is the oldest that I'm aware of worksite lactation, state worksite lactation support initiative, that it was established through legislation in 1995. And it was originally had, it was an unfunded mandate at the time that it was established. And so resources started off very minimal, including some communication materials that we produced in-house, and then also decals and a poster for designated facilities that meet the standards, that submit an application and meet the standards for a policy that provides at least basic support for worksite lactation. In 2010, I was able to apply for and receive a competitive component of the Communities Putting Prevention to Work funding. So it was one of the special high impact initiatives, and it was the only one that was committed to breastfeeding support. And through that work, we were able to develop a lot of strategies, including mostly, for sustainability purposes. It was a lot of partnerships, really infrastructure to be able to bring the program to full scale. So a lot of it is not media related or web related, but we did also produce this website. So this is CDC funded, and then some materials and some advertising. And then the program has continued to grow and be expanded, and is currently fully funded through our maternal and child health block grant. And I work in our maternal and child health area of our Department of State Health Services. So our website contains a lot of the tools and resources that are available to support the program. And we do have a printed toolkit, but that full toolkit is available here online. And it's all under this Build Your Program component. And this is really to help employers not have to recreate the wheel. There's almost too much information, I think, for employers that are just wanting to meet the basic designation. If they came to this section, they might be a bit overwhelmed, because this is best practices. This is how to really build a comprehensive, sustainable, impactful program, and not just what has to be done to meet the standards that were laid forth in our legislation. But all of these tools that are here were tested with 30 public employers, including hundreds of work sites across the state. And so there's steps, including, there's resources including communication tools to just kind of build a case for worksite lactation and answer any kind of counter arguments or common concerns, providing information about the public health case, the business case, why this is a need. And so just kind of walking through those things that people might need to even begin to start this. There's resources for people to form a planning committee within their employment setting to develop a comprehensive program of breastfeeding support. And really all the tools that they might need are here. And we welcome employers to let us know if there's other things that they would need, because we could develop those and share those here as well. And so these are all, most of these things are in an editable format in Microsoft Office format, so that they can customize these for their own setting and edit them. There's sample emails and agendas and timelines, etc., and orientation presentation here. And we do use these with our grantees. We have some mini grants for currently right now with public local cities and counties to become mother friendly. And so these tools are used with them, but they're also available to any employer in the state. There's also resources here for employers to complete a worksite lactation assessment. So there are just basic kind of brainstorming questions and landscape assessment tools. There's an online survey that they can use, and again, this was used with 30 employers and tested. There's a key informant interview guide, focus group interview guides, and then tools to help kind of interpret and prioritize the information found through this assessment process. There is information about just what is a policy, why is it important, and how do you go about not just developing it because you need the piece of written paper, but to make it work for you. And so there's tools here to help with that process. And policy is the backbone of the Mother-Friendly Worksite recognition program. There's tools to help employers understand how they'll implement their policy. So there's, that's the next page. There's tools to help prioritize kind of scale and locations and activities for implementing a program here, including a template for developing an operating plan. There's, in the implement your plan section, there's resources for how to meet the needs for space, time, education, and support with recommendations and best practice guidance culled through the literature and practice-based materials. There's also some communication tools here and a manager toolkit. And then there's tools to provide guidance on how to evaluate a program, just basic evaluation 101 with justification about why that's important. There's also, for helping with implementation, there's communication tools, including resources to communicate with managers and employees, and then for launching the program, so things that they can use actually in implementing their program, including some of our literature for employees that are produced through the department, and then ways to promote the program within the organization and within the community. And then there's additional FAQs and additional resources that have been identified by partners. There's also, when they're designated, they receive a back-end link to materials that they can use to demonstrate their recognition. So not only do we send them a packet with a decal and a poster and some other things in there, but they also have access to those materials to create, to use in whatever way they want. They can get the logos, and there's different things that they can use to help communicate their program. And the lactation room poster is one of my favorites, and I'm going to show this real quick. I know probably take too much time, but this is a poster that they receive that they can hang in their lactation space. Way to go, Supermom. We support our breastfeeding mothers and their commitment to their children and their job. We are proud to be designated Mother-Friendly Worksite. So that's just one example of some of the resources they get. And then let's see. I wanted to also show you some tools for public health partners. So we have a couple of resources those are resources for employers. We also have resources for people who want to promote the Mother-Friendly Worksite program in their community. And we work very closely with local public health partners, including through local WIC agencies and local public health departments across the state. We're a huge state, and so we really depend on our local partners. And there's a toolkit that has resources for them to plan and implement outreach activities here. Again, they're all customizable. Another thing that I wanted to show, and I know that toolkit has been adapted by several other states. Another thing that I wanted to show you is Well, first of all, there's our latest numbers for number of designated work sites. We broke 2,700. Yay, that's new to me. Let's see. Another thing I wanted to show you, and this is hidden. This is the back door. If you click under About This Initiative, there's a section here, Information for Public Health Partners. And there's resources here, including a summary of the surveys that we did with them, that employers did in our pilot work sites. And then also information from our media campaign, from our formative research that we did when working on the grant that I had, to make sure that we really understood the needs and the issues in our state. And that's very informative and probably transferable to many of your states. So those resources are here for you. There's also the program evaluation from the grant and information about how what we did to build capacity for the program. The last thing I wanted to show you was our online application, and particularly because I wanted to show you that we built this back in 2012, and this call and the other call that we had is really, motivated by our desire to use this field of our application. So one of the things that we ask for employers to do is let us know if they have work sites in other states, and they can select that here. And there's a place on the back end of our website where once we have the information, we can direct them to information about the programs in other states so that they could seek out whatever kind of recognition that that might be available to them in those states if they have work sites there. So those are some of the resources for the Texas Mother Friendly Worksite.
Great. So I just want to, before we move on, I just want to ask if anybody can, or if everyone can let us know where they're listening in from. So state and organization would be great to know, just so we can get an idea of who's on here.
And just chat that into the chat box.
Yes. So the next set of resources that we're going to hear about is resources from Kansas. So Martha Hagan and Brenda Bandy from the Kansas Breastfeeding Coalition have developed some slides, and Martha is going to be presenting those, and I can do the slides from here. So Martha, I'm going to go ahead and unmute you, and if you'll unmute your mic. Okay, Martha, can you hear us?
I think we're good. Thank you. It's great to hear what's happening in Texas, Julie. I'm kind of excited to check out your website more. So, the Kansas Business Case for Breastfeeding program was started in 2008 with a grant from HRSA. It was one of the first grants for the Kansas Breastfeeding Coalition. So, Kansas is all ran by the Kansas Breastfeeding Coalition, and I work for the state of Kansas, and Brenda Bandy is the executive director for the Kansas Breastfeeding Coalition. But at the time, in 2008, she kind of took on as the project director for the business case. And at that point, the program was just to educate anyone interested in Kansas about how to approach businesses and how to help mothers get support through their employers. We started the award program in 2011, and Brenda at that time investigated probably Texas, and I also know she used information from Florida to develop the program in Kansas. And if you do go to the next slide, our program has three levels of awards. The application's on our website, and to access that website and information, you just type in business case for breastfeeding, and you might have to put in Kansas. If I just type it in, it comes up, and it's a website for employers and employees, and employers can go and access the fillable application there. The Bronze Award is basically just conforms with the law. So it's kind of minimal. Silver adds a little bit more bells and whistles, and then gold is, they all have to have a policy, but the gold is more, the policy there. The lactation room has a refrigerator, a sink, just all those bells and whistles to make moms really, really comfortable. And we found that it's not, and I think Julie alluded to this too, it's not just having a policy, but it's also having a culture of breastfeeding support and other employees recognize. Our award is they get a certificate. You can see it's a clock, and then they have the certificate in there, and they get a press release, and they get a listing on the website. We don't have 2,000, but we're expanding, so it's always great to have more businesses come in. And then they also get a widget, and this is employers' favorite thing, is the widget. And so they get this little widget they can click on. It recognizes that employer for providing breastfeeding support, and human resources are using this on their, they'll send it to potential employees if they're trying to recruit someone to show that they have support. So I thought that was interesting that has turned out to be employers' favorite thing. Next slide. This is something that's turned out to be very effective. Brenda has started out by going to a lot of Society for Human Resource Management conferences and just exhibiting, and then worked her way into doing this presentation. So she's done it for a lot of local human resource managers, and then now has presented at the Kansas conference. And so if anyone would like to kind of see her outline for this, and that it's recognized by the Human Resource Certification Institute, feel free to contact her. Her information is included. And now she's actually started going around doing training to, again, locals around Kansas, break time for nursing mothers law and the Pregnancy Discrimination Act, so that lots more people are becoming aware of this information. And this is, and then there's also, I think it's in the next slide, there's training for mothers. There's a curriculum for that anyone in Kansas, mainly through health departments or through some hospitals, they're offering this education curriculum for mothers. So again, trying to do lots of education
That's right.
on what law requires. So anyone, these resources are all available on the Business Case for Breastfeeding website. And we do ask, though, that if you're requesting that you use the any of the flyers, the handouts, ads for newspapers, some of these were developed using a private foundation's funds, and so they've asked that the KBC just be credited in some little teeny way if you want to just adopt these for your own use. We were very lucky to have, after the initial grant, having the Business Case for Breastfeeding in Kansas funded by a private foundation. So I think that's everything I was supposed to tell you all. Oh, here's additional resources. You can see a lot of them are initial HRSA information that, again, has just been adapted. Oh, I do want to tell you about this. Recently developed thing was a referral form to help moms. Moms can fill this out. And then it gives Brenda Bandy, again, as the project director for Business Case for Breastfeeding, permission to contact her employer and help work through whatever the problem is. Recently, we had someone complete it because her employer didn't want to give her adequate break time, and so Brenda was able to acquaint them with, what's the law, how can we help you help a mom, and also really educate those employers on the benefits to them. Are there any more slides? There's Brenda's contact information, and do feel free to contact her for more information.
Great, thank you so much. So thank you to Martha and Julie and Linda for presenting some resources to share. And I'm going to make sure everyone's muted. So if you have any questions or comments or thoughts on what's been presented so far, please feel free to share that in the comment box. And we're going to move on to some success stories. So we have, Maryland and DC have a collaborative effort where they work together to recognize workplaces. And then Kansas and Missouri have a bit of a collaborative effort. So we'll be hearing again from Martha on those efforts. So I'm going to switch it over to Kelsey Hagan. So she's going to be presenting since Dana and Sahira could not be on the call.
Hi everyone, this is Kelsey. Thanks again to Amanda for introducing me. Again, Dana and Sahira couldn't be here, but they were able to share some content about their collaboration and kind of the backbone of how they got started and why they continue to do it the way they do. Just to start off, so the DC Breastfeeding Coalition developed the Washington Breastfeeding Friendly Business and Community Awards back in 2006, and then separately, the Maryland Breastfeeding Coalition had developed their own breastfeeding friendly workplace toolkit and awards in 2009. And then the DC Breastfeeding Coalition had actually approached the Maryland Breastfeeding Coalition to apply for a business case for breastfeeding train the trainer grant of $10,000. And so kind of just some backstory to this as well is that DC Healthy Start had actually been selected to receive this training a few years earlier, but by the time DC Breastfeeding Coalition knew about it, it was too late for many to participate. And so they actually asked if that they could have another training organized, but they were told it would be too hard to get approval to hold the second training in the same location unless they had an expanded reach. So this is why they reached out to the Maryland Breastfeeding Coalition to partner with them. They mentioned that they had worked with the Virginia Breastfeeding Coalition to partner with a regional advocacy day that they had a few years before this. And they were able to partner with Virginia Breastfeeding Coalition on that. But since their base is in Richmond, they decided that the Maryland Breastfeeding Coalition would be better to collaborate with for the workplace awards. And so they just felt, again, like as the slide says, they felt like they had a greater opportunity to work with the Maryland Breastfeeding Coalition. And so with this, they agreed, and then a leadership team was established where it was included with physicians, nurses, lactation consultants, and other staff from both of the coalitions. So kind of the backstory on their program is 44 individuals were trained in a 2-day program. They identified businesses prior to that and contacted them and provided them with mini grants to help them establish their worksite lactation support programs. And that way they could help with purchasing things for lactation rooms. And then they awarded their first award in fall of 2010. And they also mentioned that they used the STEP evaluation to create their program, so focusing again on support, time, education, and the place. And so this is an example of their application. So it kind of highlights the step that I just kind of mentioned in making sure the workplace has different accommodations, and they go through as well. They have sort of a bronze, a silver, and a gold level as well. So that was just an example of theirs. And so then they decided that they liked working together, so they wanted to keep it going. And even though that grant money was up, they still budget for those awards that they give out, even though most of the work that they have is done through volunteers. So they only, use that funding for those actual plaques that they give. And they have an awards luncheon that they talk a little bit more about as well. So in order to keep it going, they decided to switch off whoever, coordinates the awards every 2 years. So essentially DC will take charge for 2 years, and then they'll switch off to Maryland for 2 years. And it was a way to kind of delegate the work, but also make sure no one's getting burnt out as things start to pile up. it just kind of keeps them involved. But they also still include the other one when they make main decisions. So they don't just, Maryland doesn't just decide who gets the awards on their own. They're just the main point of contact. So they still keep that collaboration. And so kind of their timeline is in the spring, they start talking about their program and if they need to change anything about their program or anything with that. And then they actually have a press release written, which is kind of the call for those nominations. So this link here is that nomination and talking about, their workplace award, and they ask for employees or businesses to nominate themselves or other places for that award. They talked about, I guess, it's hard to get media to pick it up. So they do a lot of sharing on social media. And then they will reach out to businesses themselves as well. And then in July through September is when they have that nomination period open and receive those. They actually do site inspections, so they will go out to the businesses and inspect their lactation room and make sure it has all of the components that they said that they have. And they do that in October. And then in November is when they have a big award ceremony for all of the businesses that they hand the award out to. And then they issue another press release for that. So they mentioned that since 2010, they've awarded almost 100 businesses. This link here on this slide actually is a link to all the awardees that they've given this to. And they talked about word has just kind of spread organically from business to business and through employees. So they also kind of talked about, they question if they should continue with the award after the ACA mandate, but they said that they're usually encouraged because they continue to get a large influx of nominations, so that pushes them forward to continue giving the award out. So some lessons learned that they had is, as I mentioned before, they really liked working together. They liked that it, didn't burn one individual out. They had that overlap. They also talked about just the geographical area and how there's a lot of business overlap in both DC and Maryland, especially with federal government agencies. And so it kind of just makes sense because of that area. They talked about, some years they have more nominees and give out more awards than others, but that it just depends. And they also talked about they really enjoy doing the site visits, and that since it's it's volunteer run through both of the coalitions, that's really an exciting way to get their members involved to go out and do those site inspections. And then again, they just talked about how they continue to see businesses get really excited about getting nominated for the award, and that they really enjoy the ceremony and having that award given to them. And so that's it for DC and Maryland. So now I'll hand it back over to Amanda.
Great, thank you so much, Kelsey. So Kansas and Missouri have a bit of a collaborative effort. I think it looks a little different than Maryland and DC. So I want to invite Martha back on to discuss how they're working together with Missouri. And I'm going to unmute you, Martha, and mute us. Okay, Martha, go ahead.
Okay, great, thanks. Yeah, we do have a different approach, and it really started because in Kansas City, which straddles both sides of the state line, Missouri and Kansas, there's an organization called the Mother-Child Health Coalition, and they wanted to establish a local award, and that they would give to businesses on both sides of the state line. And so Missouri approached Kansas to share materials, and so those were shared with Missouri so they could start a business case for breastfeeding award. The partnership with the Mother-Child Health Coalition allows the MCHC to give an award, and then they contact Kansas or Missouri, and so then that employer receives a Missouri or a Kansas award. So it's not exactly a partnership. We're working, with that organization, and we both have criteria for a little bit different criteria. MCHC has criteria, Missouri has criteria, Kansas has criteria. We've ran into a little bit of an issue because in Kansas, for the business case for breastfeeding award, the award is for an individual location. It's not for the organization as a whole. So if there's an organization with 3 locations and they might have a policy that's for all 3 locations, but all 3 locations may not have an adequate room for moms. And so I'm not sure. I think in Missouri they would give the award to the organization, and then they could have an award for each individual location. In Kansas, we might give it to the organization because that corporate office has a lactation room and good support, but it doesn't necessarily mean that each one of their separate offices does, and so they get 1 award. So that's a little, something interesting we ran into is like, what is that criteria? So when sharing, I think, or collaborating, it's, important to know. We also have another type of collaboration going with local breastfeeding coalitions. In Wichita, there was a chronic disease risk reduction grant for the health department. They received some funding that they would provide local businesses through a wellness program with the opportunity to get a chair or a refrigerator or a breast pump to help set up a lactation room in the business. And then they would have that business apply for a business case for breastfeeding award. That now program has been, they had a little funding left. They gave it to the local Wichita Breastfeeding Coalition, and they're the ones providing businesses with equipment to help set up a lactation room. And then again, the Kansas Breastfeeding Coalition is giving the statewide award. And that's also working for other local coalitions because we have a community supporting breastfeeding initiative through the Kansas Breastfeeding Coalition. And one aspect of that is that each community to receive this award has to have a certain percentage of their employers in that community receive the business case for breastfeeding award. So again, local breastfeeding coalitions are implementing and educating, and then the Kansas Breastfeeding Coalition is giving the award. Brenda is also working with Nebraska right now and New Mexico, helping share resources. And in Nebraska, since Nebraska's close, she's actually going there to then provide some technical assistance on how do you approach a business, and actually going with their program director to some businesses to talk about setting up lactation support. So she's been happy to do some technical assistance for other states also. So that's our sharing and collaboration that we've done.
Great, thank you so much again for sharing. So we've had a couple of questions about the sharing of the resources, which actually leads really nicely into the next sort of portion of this call. So best approaches to collaboration. The thought is to have a sharing of these resources so that they can kind of be made available to programs in other states or coalitions in other states. And we wanted to start generating some ideas about the best way to share these resources and the best way to start a collaborative effort. So I just briefly wanted to kind of share some thoughts that we had and maybe get some thoughts going on ways to do that. So there were 3 aspects that we wanted to start everyone thinking on. One is how to share to other initiatives, so how to share to other states. And one way that we thought of doing this could be developing a platform. So either using Basecamp as a platform, there's Slack or Yammer If you have an opinion on these, please type in what you've used before on the comments box. So we thought about setting up let's say a base camp, if we were going to use that, and having a space there where people can share their resources. So a collection of resources from any state who is interested in having this collaborative effort. And also creating a space on Basecamp or one of these platforms to where people can talk with each other to set up a discussion forum, so we can share best practices and kind of share some wins and some barriers on there. So if you have a thought on whether this kind of platform idea would be a best approach, please share that. And if you have a thought on which of these platforms you have experience with or would like to use, please share that as well. And then the other arm of sharing is how to share to employers. So do we want to volunteer this info to employers right off the bat? I know Julie mentioned that on the Texas website, employers can let us know if they have other work sites in other states so that we can be aware of that information and kind of be proactive in sharing with them what other initiatives exist in the states where they also exist. But then we've also had encounters with some of our workplaces where they've asked if there are other initiatives like the Texas one in other states, because they do have workplaces in other states. So just to get an idea of whether we should share this info up front with work sites or just wait until they ask or wait till we know if they have a workplace in another state. And then the last outreach effort is to the public. So one area that might be a possibility is to share a summary of each program in each state on everyone's website, or at least creating either a formatted PDF or a formatted Word document that can be easily incorporated into a programmatic website. And then if that is something that folks are interested in, we would need to know what information to put on that brief summary. So some things that we have thought about is sharing the overarching kind of goal of the program, the criteria that are needed for recognition, and then having a link to the application or having a link to the person's email who is in charge of the application process. So this information would be publicly displayed on either the coalition website or the programmatic website, so that anyone who's interested in seeing this information, public, employers, moms, can easily access that information. So we would love to hear some of your thoughts on best ways that you think we could go about sharing information on these initiatives to these three groups of folks. And then next up, so in moving forward with this collaborative effort, we really want to identify states who are interested in moving forward in the collaborative effort. So if you're interested in this resource sharing, or if you're interested in sharing information about other states' programs with your employers that you work with, we want to know who those folks are and how we can engage everyone in collaboration. And then the next step also would be to collect the programmatic information. So just to have an area where each program provides information about that they want to present to other states. So going back to this sort of criteria, summary of the program, the criteria needed for recognition, and then a space where people can be directed to the program. And then again, we also want to develop that sharing platform. So once we kind of get everyone's input onto what works best, we'd like to build that and provide that as a space for everyone. And then being able to distribute that information that's on that platform to folks to interested participants, to interested employers, to the public who is interested in. So these are kind of the steps that we have planned out in moving forward with this collaborative effort. And we would really love it if all of you who have been listening in today would be a part of this collaborative effort. And that's all that we had for this as far as slides. And I wanted to give some space for questions. So if we have any questions, go ahead and type those in. Or if we already have any, it doesn't, yeah, we have some questions about resource sharing. So our these resources on the Texas Mother Friendly website are available, like the toolkit that Julie went through. And then the other states that have presented, we'll get in touch with them to see if they'd like to share these before we get a platform.
And just as Martha said, if folks want, we have worked with several other states to adapt the Texas materials, and that's certainly, we certainly want to help with that, and so that folks don't have to reinvent the wheel. But we do have a process for that, including if there's major adaptation, we need to review it, and then proper credits, and then we have a form that basically allows, gives states that we have an agreement on how the content is used.
Yeah. All right. And I just want to note that this webinar has been recorded. So if you would like to listen again or share with other folks, we'll be sending out the link. And then the next step that we've planned after this webinar is to send out some communication just to gauge who's still interested in collaborating, and maybe get some information that would direct us in the path of being able to share resources and also share programmatic information. And if you have any, I did want to acknowledge the wonderful folks who were involved in putting this forum together and involved in this whole state initiatives collaborative effort, who have just been instrumental. If you have any questions or comments or thoughts, please do get in touch with us. So this is the Mother Friendly Worksite email, and Kelsey Heron is on this slide, but you can also address it to Amanda Reet or Julie Stagg if you have questions or thoughts, and we hope to be hearing from you. Thank you all so much, and thank you to our presenters.
No question? Nobody had
No,
anything to share?
No.
Okay.
One more question I just got, but will the states coalition surveyed by ETLs or will it be shared moving
I
forward?
think that those were all the questions that people wanted to
Okay.
It's pretty much just resource sharing.
Okay. Nah. Well, maybe we just create a template and send it out and be like, will you agree to allow us to post this on our website?
Yeah, that's
And
what
in a really standard form, like give them clearer guidance.
that was my. Maybe I should have been more clear on the next communication.
Can't say
That was
anything.
my thought, was just to say could you, if you are interested in
Link it something. Okay.
moving forward, please provide this information.